Please see this picture. I left a lecture of last time on this topic, and you have several questions regarding to the tendon of the quadriceps. So look at this beautiful picture. You see that how the tendon of the quadriceps femoris is formed, and how the heads merge into the tendon. This is for the vastus lateralis. This area is for the vastus medialis, and this is for the rectus femoris, and behind this lies the vastus intermediate. See here that the all fleshy fibers finally converge at this level to form a tendon, and this tendon is called the tendon of the quadriceps femoris. Now this tendon is mainly inserted into the patella. So this is the area for the patella where the fibers of all heads converge or merge to form the quadriceps femoris and attached onto this bone. Now from this patella, trace downward up to the tuberosity of the tibia, you will see another ligament wide enough, and this one is called the patellar ligament. So patellar ligament or ligamentum patelli is an extension of the tendon of the quadriceps femoris from the patella up to the tubercle of the tibia or the tibial tuberosity. Now, once again, see here that what are the retinacula? Retinacula are nothing. They are just the extensions or condensations of the fibrous tissue. Their texture is same as in case of the ligaments. Now, these all are the extensions of the tendon, or you can say this is the extension from the vastus medialis, and this is the extension of the vastus lateralis. And these extensions, right from the level of the margins of the patella extends towards the either side, and they just blended or merge with the capsule of the knee joint. These extensions of the tendinous fibers of the vastus medialis and the vastus lateralis are called as the retinacula. This one is the medial retinaculum, and this one is the lateral retinaculum. So the retinacula are just the extensions of the tendinous fibers of the vastus medialis and the vastus lateralis, and they extend on either direction, or you can say from the sides of the patella to merge with the capsule of the knee joint. And in this way, they strengthen the capsule of the knee joint. They provide stability to the knee joint in this way. Finally, see this area and see the direction. This is the direction of the fibers of the vastus lateralis. They are oblique in direction, whereas these fibers are slightly horizontal. These are the lowest fibers of the vastus medialis. And these lowest fibers of the vastus medialis are finally inserted or attached on the medial border of the patella. Now, these fibers are important in stabilizing the patella, or they prevent the lateral movement of the patella when the quadriceps femoris contract for the extension. So these fibers just hold the patella at this level and prevents its lateral displacement during the contraction or during the movements performed by the muscle. Which muscle? The quadriceps femoris. So this is not difficult. This is very simple. And remember that the quadriceps femoris muscle is the powerful extensor muscle of the knee joint. The tone of the muscle, the tone of the quadriceps femoris is largely responsible for the stability of the knee joint. So the major stabilizing factor for the knee joint is the tone of the quadriceps femoris muscle. It is a powerful extensor. Now see another group of the muscles. Very simple. This is the medial compartment of the thigh. When you see the medial compartment of the thigh, you can say that it consists of certain muscles, and these muscles are supplied by the obturator nerve. Remember, The front of the thigh muscles are supplied by the femoral nerve, but we are talking about the medial compartment of thigh, which is supplied by the obturator nerve, and its arterial supply is same as in case of the anterior compartment of the thigh. And the artery is just called as the arteria profunda femoris. The profunda femoris artery or the arteria profunda femoris, it is called profunda because it lies deep to the femoral artery. It is a branch of femoral artery and it arises from the deeper aspect of the femoral artery. It is the main or the chief arterial supply to the all compartments of the thigh, whether anterior compartment, whether medial compartment or the posterior compartment. So when you see the medial compartment of the thigh, just on the medial side of the front of the thigh, you will see a group of the muscles called as the which all are called as the muscles of the medial compartment of thigh. Mainly, the muscles perform the adduction of the thigh at the hip joint. So they are also called as the adductors of the thigh. I told you that when you remove the deep fascia from the front of thigh, the immediate muscle that you identify is the sartorius. Similarly, in case of the medial side of the thigh or the medial compartment of the thigh, when you remove the fascia lata, the immediate muscle is called as the gracilis. This is the most superficial muscle, this number 4, is called as the gracilis. It is called gracilis because it is cylindrical in structure. It is cylindrical in the shape, therefore this muscle is called as the gracilis. And next to the gracilis, you will find the adductor longus, and deep to the adductor longus lies the adductor brevis and the adductor magnus. And at this level, you will find another muscle which just cross the hip joint, and this one is called the obturator externus. Sometimes this muscle include into the medial compartment of thigh, and this one is called the pectinus. But actually, this is a muscle of the front of thigh. And remember, I told you that the pectinus is mainly supplied by the femoral nerve, but sometimes the obturator nerve also supplied to the pectinus muscle. Obturator nerve also supplied to the pectinus muscle. What is the main action of these muscles? Adduction of the hip joint. So they all are called the adductors. Now look at the gracilis. The gracilis is the only muscle. The gracilis is the only muscles of the medial compartment or the adductors that crosses both joints, the hip joint as well as the knee joint. So it possesses the action on the hip joint as well as the action on the knee joint. And remember this point, they are supplied by the obturator nerve. They are supplied by the obturator nerve. So it's very simple to remember. It is very simple to identify the musculature of the medial compartment of thigh like this picture. Again, see here, these are just the names of the adductors. And what are the adductors? Means the muscles found in the medial compartment of the thigh, adductor longus, the adductor brevis, adductor magnus. You will see the pectinus. The pectinus possesses the adduction. It possesses the adduction. Its action is adduction, but it includes among the muscles of the front of the thigh. It just supplied by the, in addition, by the obturator nerve. And see another muscle finally, that one is the gracilis. So these muscles are not difficult to identify or remember. Now see the very first muscle that we found in the medial compartment of thigh is just called as the gracilis. And these all are the points you must remember in the form or in order of frequency, like the origin, like the insertion, like the location, or you can say the actions. But remember, the pubis, the body and rama of the pubic bone are mainly responsible to give origin to the muscles of the medial compartment of the thigh. And ischium is mainly responsible to give origin to the muscles of the posterior compartment of thigh. And ilium is responsible for the attachment point of view to the flexor muscle, the extensor muscles of the front of the thigh. So the extensors mainly attached on the ilium, adductors mainly attached on the pubis and its rama, and the flexor muscles, the hamstring muscles, or the muscles of the posterior compartment of thigh are mainly originated from the ischium. So there are three parts of the hip bone, and these three parts of the hip bone respectively give attachment to the extensors, adductors, and the flexors of thigh. Now, as the origin of the Gracilis is concerned, as I told you, the pubis is responsible. We can say it arises from the medial surface of the inferior body of the pubis. The Gracilis arises from the inferior ramus of the pubis. Gracilis arises from the inferior ramus of the pubis, or simply you can say it arises from the body of the pubic bone and the adjacent part of the inferior ramus of the pubis. Now see its insertion. Insertion of this muscle is just on the tibia. The gracilis is inserted onto the tibia. So where is the tibia? You see this picture. See this picture. This is the red line for the gracilis muscle, the most cylindrical muscle. Still the fleshy fibers crosses the distal end of the femur. Then they convert into the tendon, means now they crosses the knee joint, and finally they are inserted on the upper part of the medial surface of the shaft of the tibia. Upper part of the medial surface of the shaft of the tibia. Exactly at this area, we already discussed the insertion of the sartorius muscle. Sartorius muscle. Sartorius also inserted here. And then just behind the sartorius, there is a muscle which is called the gracilis attached on the same area. And there is another muscle which is called the semitendinosus, which is also attached at this area. And what is the area? This is the upper part of the shaft of the tibia on its medial side, or upper part of the medial surface of the shaft of the tibia. And the insertion of these three muscles always remembered by the students by term a formula called as the gun between two soldiers. Gun between the two soldiers. It means the intermediate position at the insertion area is occupied by the gracilis, and in front is the sartorius, and behind is the semitendinosus. So now this area is for the muscles of the attachment of the thigh. Now what is the nerve supply of this muscle? The nerve supply of the gracilis is just called as the obturator nerve. Obturator nerve, anterior deviation of the obturator nerve. And what are its main actions? It crosses the two joints. So its first action occurs on the hip joint, and at the hip it performs the adduction. So when this muscle contracts, it moves the thigh towards the midline. It also crosses the knee joint. So its other action on knee joint is just the flexion and the medial rotation of the knee joint. Flexion and the medial rotation of the knee joint. Or you can say it flexes the leg at the knee joint. At the hip joint, it causes adduction of the thigh at hip, and second action, then it causes the flexion and the medial rotation of leg at the knee joint. Now, when we remove the adductor longus in the medial compartment of thigh, you will see another muscle, and this muscle is called the adductor longus. And like the gracilis, this muscle also gets origin from the pubis. just from the pubis. So origin of this muscle is from the anterior surface of the body of the pubis. It just arises by a rounded tendon from the anterior surface of the body of the pubis. And where it is insertion? The insertion of adductor longus is just on the posterior aspect of the femur. Posterior aspect of the shaft of the femur possesses a rough ridge called as the linea aspera, and the middle third of the linea aspera give attachment to the adductor longus muscle. I have certain pictures for the insertion of these all muscles on the femur. I will show you. Now see the actions. The main action is the adduction, and this adduction occurs at the hip joint. So it adducts the thigh at the hip joint, and in addition to the adduction, when it contracts, it also causes the lateral rotation of the hip joint. The origin of the muscle is anterior. The origin of the muscle is anterior, and the insertion is on the posterior surface of the linea aspera. When the muscle contracts, the belly shortens, and it causes the lateral rotation of the femur. And like the previous, this muscle is supplied by the anterior deviation of the obturator nerve. It is supplied by the anterior deviation of the obturator nerve. It is supplied by the anterior deviation of the obturator nerve. Now look at this picture. This is just for another muscle. We're talking individually about the adductors, especially for the origin, for the insertion, innervation, and action. So this one is the adductor brevis. This one is the adductor brevis. Now the adductor brevis, from origin point of view, once again we say that the adductors are mainly attached on the pubis. So see here, which part of the pubic bone is responsible? This is just the inferior ramus of the pubic bone. Insertion is in the same area. That one is the linea aspera on the shaft, mainly on its posterior aspect. Nerve supply, same. That one is the antideviation of the obturator nerve. Actions are also same. And all actions occurs at the hip joint, like the adduction of the thigh, and it also assists in the lateral rotation of the thigh. So the muscle is called adductor brevis. Muscle is called adductor brevis. Look at this picture of the adductor brevis, and you just concentrate that how contraction of this muscle causes the lateral rotation of thigh at the hip joint. See here, it is attached anteriorly on the inferior ramus of the pubis. This is anterior attachment, and the fibers move towards their insertion. And when they reach to the femur, they passes posterior to the femur, and finally they are inserted onto the linea aspera. So here fibers lies anteriorly at the origin, and fibers lies posterior at the insertion. When this muscle contracts, what happens? The belly becomes shorter, and this femur rotates into this direction. This femur rotates into the lateral direction. So we can say it causes the adduction. Adduction means when this femur or thigh moves towards the midline, and simultaneously this femur or thigh also rotates laterally. In this way, the adductors assist in the lateral rotation of the hip joint. You can't say that the adductors, mainly the adductor longus, the adductor brevis, and the gracilis, perform the movement of the medial rotation of thigh. They perform the lateral rotation of thigh. In addition to the adduction of the thigh. So adduction is associated with the lateral rotation, not with the medial rotation. Now look at this picture. Look at this picture. This is for a large muscle, again of medial compartment of thigh, and this one is called the adductor magnus. Now see that this muscle originate from the two parts of the hip bone, and it is inserted again into the two different parts of the femur, and it is supplied by the two different nerves. Its very first part is called the adductor part of the adductor magnus, and second part is called the hamstring part of the adductor magnus. It means one half of the muscle that originate from the pubis, and the istiopubic ramus or the inferior ramus of the pubis is called the adductor part of the adductor magnus muscle, and it is inserted into the femur. This part is supplied just by the obturator nerve, the posterior deviation of the obturator nerve. A second part arises from the ischial tuberosity, and it is also attached on the femur, different parts. I will show you a picture. And the hamstring part of the adductor magnus that originate from the ischial tuberosity is supplied by the tibial nerve or the sciatic nerve. Very simple, the sciatic nerve. Now look at this picture. Look at this picture. That this is the adductor magnus. This muscle is called as the adductor magnus. This is the one part which is called as the adductor part, and this one is the second part which is called as the hamstring part. The adductor part of the adductor magnus muscle mainly originate from the inferior ramus of the pubis, and these fibers move towards its insertion or go towards their insertion, and this insertion is just the linea aspera on the posterior surface of the shaft of the femur. Whereas this part, right from here, arises from the ischial tuberosity, and this part of the adductor magnus, after getting origin from the ischial tuberosity, convert into a tendon, and mainly it is inserted into the adductor tubercle of the femur. And this part is called the hamstring part. This part is called the hamstring part. Adductor part is supplied by the posterior deviation of the obturator nerve, and we all know that the medial compartment of thigh is innervated by the obturator nerve, and this one is the hamstring part. Hamstring part means the posterior compartment of the thigh or the flexor muscles, posterior compartment of thigh and the flexor muscles of the knee joint. And the flexor muscles of the knee joint or the posterior compartment is supplied by the sciatic nerve. So this portion of the adductor magnus muscle is supplied or innervated by the sciatic nerve. And see the separate origin. It is inserted onto this bony projection just above the medial epicondyla of the femur and called as the adductor tubercle, whereas this is the area for the linea aspera. So this whole one is the linea aspera for the adductor part of the adductor magnus. And in this way, a large opening is formed in the adductor magnus muscle. So see at the insertion, this is the termination of the insertion of the adductor part, and this is the termination of the insertion of the hamstring part, and between these two, a large opening is formed, and this one is called as the adductor hiatus. Hiatus means opening. Hiatus means opening. Adductor hiatus. And through this opening, the femoral artery passes from front to the posterior and becomes the popliteal artery. So femoral artery passes through here to reach into the popliteal fossa or the posterior compartment of thigh to become the popliteal artery. And similarly, the popliteal vein passes through this opening and ascends to reach into the front of thigh as the femoral vein. So artery and vein passes through this large opening. This is the simple picture of the posterior aspect of the femur. It is focused mainly on this ridge. Where is the ridge? This ridge, this roughened ridge on the posterior surface of the shaft of the femur is called the linea aspera. And this linea aspera provides attachment to the muscles. Which muscles? muscles of the medial compartment of the thigh, like the adductor brevis, the adductor longus, and the part of the adductor magnus. Again, look at this picture. This one is the distal end of the femur, distal end of the femur, and see here that this one is the medial epicondyle of the femur. Just above it lies a small area, small raised area, and this small raised area is called as the adductor tubercle. This adductor tubercle is for the insertion of the hamstring part of the adductor magnus muscle. Look at this picture once again and see everything is clear. Everything is clear for the insertion point of view of certain muscles of the medial compartment of the thigh. See this area. This one is the part of the linea aspera, and this blue line indicates the site of the insertion at the linea aspera for the adductor longus muscle. Adductor longus muscle. Which muscle? Adductor longus muscle. See this large area. This is the upper part of the linea aspera, and this is for the adductor magnus muscle. So this is the adductor magnus muscle. Again, see this large area beside this adductor longus and magnus, and this is for the adductor brevis. So this one is the adductor brevis. Last time I told you regarding to the pectineal line, and I told you that the pectineal line lies just above the linea aspera at this level. So this one is the pectineal line for the insertion of the pectineus muscle, and this is the linea aspera, gives attachment to the several muscles, not only adductor muscles, but several other muscles are attached on the different lips. The lateral and the medial lips are in between the lateral and medial lips of the linea aspera. So again, see here that this one is the pectineal line just above the linea aspera, and it is for the insertion of the pectineus muscle. Insertion of the pectineus muscle. Look, the greater trochanter of the femur. This one is the area of the greater trochanter of the femur. This is the medial surface of the greater trochanter of the femur. And the medial surface of the greater trochanter of the femur possesses a small depression, and this small depression is called as the trochanteric fossa. This trochanteric fossa, or the depth of the trochanteric fossa, provides insertion or attachment to another muscle which is called as the obturator externus. Obturator externus. So just see the area where the obturator externus is inserted. But what is the origin? What are the other details of the obturator externus? They are very simple. See these previous pictures. Look at this picture. Look at this picture. You will see the number 1, the 2, 3, and 4. Now go and see this muscle, which is called as pectinus. And just above the pectinus, edge to edge, this is the area for a muscle, and this muscle is called as the obturator externus. Obturator externus muscle. Now this obturator externus muscle is supplied by the, posterior deviation of the obturator nerve. It is supplied by the posterior deviation of the obturator nerve. Its insertion, I just told you that it is attached on the medial surface of the greater trochanter. Origin is very simple, that this muscle arises from the outer aspect of the obturator membrane and the adjacent areas of the body of the pubis, the pubic and the ischial rami. So after getting origin from the obturator membrane, the muscle moves laterally towards its insertion, and insertion lies at the trochanteric fossa. Insertion lies at the trochanteric fossa. Action of the obturator externus is very simple. That it just causes the lateral rotation of the hip joint. So it is the powerful lateral rotator of the hip joint. It not assist, it not augment. It's a prime mover. Prime mover like the preformis, like the obturator internus. The obturator externus is also considered as the extensor. It is called as the extensor of the hip joint. Yes or not? No. Its name is obturator externus because it lies on the outer aspect of the obturator membrane. Obturator internus, it gets origin from the inner aspect of the obturator membrane. But both are the lateral rotators of thigh at the hip joint. Now please look at this picture. Now this is a picture of the lumbar plexus. I told you that the lumbar plexus is formed in the region of the abdomen, just on the sides of the lumbar vertebrae. So try to identify L1, L2, L3, L4, L5. They indicate the position of the lumbar vertebrae. And see on one side that these lumbar vertebrae gives attachment to a muscle called as the psoas major. So this muscle, this musculature is called as the psoas major. All roots and their deviant form the lumbar plexus within the moss or within the substance of the psoas major muscle. And different deviants or different branches of the lumbar plexus then emerge either from the front or from the lateral or from the medial side of the psoas major muscle. Now, this is the line for the obturator nerve. See here, this is a line for the obturator nerve. So this one is the obturator nerve. This is the obturator nerve. And this is the line for the femoral nerve. See here, this is the femoral nerve. It emerges from the lateral aspect of the psoas major. Then it descends through a gutter or depression between the iliacus and psoas major. And then it passes just beneath the inguinal ligament to enter into the front of the thigh, where just below the inguinal ligament, it terminates into the several branches. So this is just picture showing you that how the branches of the lumbar plexus supply to the muscles of the anterior and the medial compartment of thigh, respectively the femoral and the obturator nerve. Whereas the posterior compartment of thigh is supplied by the sciatic nerve, and sciatic nerve is the branch of the sacral plexus. Sciatic nerve is the branch of the sacral plexus. So just leave the sciatic nerve and see another picture for the details of the muscular branches of the femoral and the obturator nerve. Thus here, this is the root value of this is the root value L2, L3 and L4. For what? For both the femoral nerve as well as the obturator nerve. The posterior deviants of the L1, L2 and L3 join to form the femoral nerve, and the anterior deviants of the L2, L3 and L4, they join to form the obturator nerve. So these all are the anterior deviants from L2. This is the anterior deviant of L3 and this is the anterior deviant of the L4. They all join to form the obturator nerve, mainly supplying to the several muscles of the medial compartment of the thigh, including the articular tracts or articular branches to the hip joint and the knee joint. And see here that the roots are same. That one is the L2, L3, L4. But now the deviants are posterior. This is the posterior deviant. This one is the posterior from L2, and this is L3, and this is the posterior deviant of L4. All join or merge to form another nerve, and this nerve is called as the femoral nerve, which supply to the several muscles. Either in the pelvic region or in the anterior compartment of the thigh. Now look at this picture once again and recall some knowledge from the nervous system. Recall your knowledge from the nervous system. In case of the plexus of the limbs, the anterior deviants mainly supply to the flexor muscles, and the posterior deviant mainly or only supply to the extensor muscles. Mainly in the limbs, the group of the muscles are just two, the flexor and the extensor. The flexor muscles are always supplied by the anterior deviation of the plexus, whether in the upper limb or in the lower limb. Whereas the posterior deviations of the plexus supply only to the extensor muscles. But there is an additional group of the muscles in the lower limb. That one is the adductor muscles. Adductor muscles are the medial compartment of the thigh. And remember that the medial compartment of thigh is supplied by the obturator nerve. It is very simple to explain that during development or embryologically, the adductor muscles are modified or derived from the flexor muscles. What I say? That the adductor muscles are modified or derived from the flexor musculature. Therefore, they are supplied by the anterior deviance. And the extensor muscles in case of the thigh lies on the anterior aspect and they are supplied by the posterior deviance. So when we think about the root values of the femoral and the obturator nerve, we always say that the root value of the femoral nerves are the posterior deviance of the second, third, and fourth lumbar nerves, fourth lumbar spinal nerves. And in case of the obturator nerve, we just modify this sentence by one word, that root value of the obturator nerve are the anterior deviance from the second, third, and fourth lumbar spinal nerves. Second, third, fourth lumbar spinal anteriorly for obturator. Second, third, fourth spinal nerves posterior deviant for the femoral nerve. For the femoral nerve. Last time, one student asked about the question that source measure is supplied by the lumbar plexus or not. Yes, you can say that the source measure is supplied by the branches of the lumbar plexus, but in very simple way, you can say they are supplied by the separate branches that arises from the first lumbar, second lumbar, and third lumbar. So see these separate branches. These all are the separate branches before forming the plexus. These are the separate branches from the L2, L3, L4 or L1, L2, L3 before forming the plexus for the source major muscle. So this is the area for the source major and they are supplied by these separate branches. But here the femoral nerve is formed or completed and it gives a branch to the iliacus muscle in the iliac fossa. Then it enters into the thigh just beneath the lateral part of the inguinal ligament, and then it gives several muscular branches to the muscles of the front of thigh. The first one is sartorius, then it gives branches to the pectinus, then it gives branches to the several groups or the parts of the quadriceps muscle, that is the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. And finally, it terminates to give articular branches to this one, and this one is called the knee joint. So it gives articular branch to the hip joint, give articular branch to the knee joint, and these all are the muscular branches for the several muscles of the front of thigh, including this short muscle, which is called as the articulus genu, which is considered as a part, dissociate part of the vastus intermedius. And see that how the femoral nerve enters into the front of the thigh. And this one is the line for the obturator nerve. This is the line for the obturator nerve, and see that how it enters into the thigh. It enters into the thigh through the obturator canal. And this obturator canal is a small gap in the obturator membrane within the obturator foramen, and here it immediately divided in the front of thigh, immediately divided into the anterior and the posterior deviance. The posterior deviance supply to the obturator externus muscle. The posterior deviance also supply to another muscle which is called the adductor magnus muscle. Which part of the adductor magnus? Adductor part or adductor half of the adductor magnus. And sometimes the same posterior deviation of obturator nerve also supplied to the pectinus, but the pectinus muscle is usually supplied by the femoral nerve. Whereas this long line is for the anterior deviation of the obturator nerve. And I told you that it's supplied to the adductor brevis, supplied to the adductor longus, and it's supplied to the gracilis. So this one is the main trunk of the obturator nerve. It passes through the obturator canal, a small gap in the obturator membrane. Immediately it divides into the anterior and posterior branches. The anterior branch first gives, the anterior deviation gives branch, which branch? Muscular branch to the adductor brevis. Then it also gives a branch to the adductor longus. It also gives a muscular branch to the gracilis muscle. And finally, it travels into the subsartorial canal and terminate to supply the knee joint. Again, see here, this is the main trunk of the obturator nerve, and this time this one is the posterior deviation. The posterior deviation of the obturator nerve supplied to the obturator externus. So this is the obturator externus. It's supplied to the adductor magnus. So this one is the adductor magnus, the adductor part. And occasionally, it gives a muscular branch to the pectinus muscle. So this beautiful drawing showing you that how femoral nerve supplying to the muscles of the front of thigh and how the obturator nerve finally supply to the muscles of the medial compartment of the thigh. Now, these are the other fine details of adductor magnus muscle, but this time we focus on the hamstring part. So try to identify the hamstring part. It says that hamstring part is mainly originate from the ischium. Ischium means the ischial tuberosity and ischial ramus. And where it is inserted into this area, this blue stalk, and it is considered as the adductor tubercle, which is just found above medial epicondyle of the femur. What is the nerve supply? It is supplied by the sciatic nerve. Now see the different actions. What are the different actions? That you think about the action, of the hamstring part and the adductor part. The action of the hamstring part of the adductor magnus is on the thigh. And what is that action? The extension or extends the thigh at the hip joint. But what is written in your book? Very simple. That it extends the thigh at the hip joint. It is just the action of the hamstring part. And what is written in your book for the adductor part? That it causes the adduction and the lateral rotation of the hip joint. So muscle not crosses the knee joint. So it possesses just the action at this joint, and first action for the adductor part, that one is the adduction and assists the lateral rotation of the thigh, and second one is called as the extension of the hip. Now, here is the picture for the obturator external muscle. This is the origin of the obturator externus muscle, as we previously discussed from this area. And this area is considered as the outer aspect of the obturator membrane. So from the outer aspect of the obturator membrane and the adjacent part of the pubis and ischium, the muscle fibers moves towards the insertions. Here, that the tendon passes behind the neck of the femur and inserted into the trochanteric fossa. And this muscle mainly performs the lateral rotation at the hip joint. Now see this very simple picture on the upper third of the thigh, upper third of the thigh, just on its medial side. So the front of thigh in its upper part on its medial side shows a slight depression. And this slight depression is called as the femoral triangle. This depression is called as the femoral triangle. So try to identify the boundaries of the femoral triangle. But what is the location of the femoral triangle? That this triangular depressed area is situated in the upper part of the medial aspect of the thigh, just below the inguinal ligament. So first of all, trace this white line. This is a line for the inguinal ligament. And we claim that a depressed area on the medial side in its upper part, a depressed area is called as the femoral triangle. And see its boundary. This is one boundary. So identify this muscle called as the sartorius muscle. See another boundary. This is another boundary for the femoral triangle, and identify this boundary on the medial side as the adductor longus. Now you can say that this is the base of the femoral triangle, which is exactly formed by the inguinal ligament. This is the lateral border of the femoral triangle. It is formed by the sartorius muscle. Okay, and this is the medial border of the femoral triangle. It is formed by the adductor longus muscle. It is formed by the adductor longus muscle. And this is the apex of the femoral triangle. Where lies the apex? Where the medial and lateral borders, join with each other. So this is the triangle. This is the apex of the triangle. This one is the base of the triangle. This one is the medial border of the triangle, and this one is the lateral border of the triangle. So this triangular depression is present in the upper one third of the thigh, slightly on the medial side. So these are just the boundaries, the base, the medial border. Where is the base? This one. This one is the base of the femoral triangle, and this one is the inguinal ligament from the anterior spine up to the pubic tubercle. This is the medial border of the femoral triangle, and this is formed by the muscle of the medial compartment of thigh called as the adductor longus. And this one is the lateral border of the femoral triangle. It is formed by the sartorius muscle. Now see that this area between these three boundaries is slightly a gutter-shaped or depressed area, and these all are the muscles which form the floor of the femoral triangle. Now trace the floor of the femoral triangle for their structures or muscles from lateral to medial. It's the lateral aspect, and this one is the medial aspect. Now trace the structures. You can say the first muscle on the lateral side that forms the floor is called as the iliacus. A second muscle is called as the psoas major. A third muscle is called as the pectinus, and the fourth muscle is called as the adductor longus. Remember that the adductor longus, in addition to form the medial border of the femoral triangle, also form the part of the floor of the femoral triangle. So adductor longus include among both the medial border of the femoral triangle as well as the floor of the femoral triangle. So these all muscles from lateral to medial side, contribute in the formation of the floor of the femoral triangle. Again, see that this one is the iliacus muscle. This one is the iliacus muscle. This line is for the psoas major muscle, and this is for the pectinus muscle, and this is the area for the adductor longus muscle. So remember, the boundaries of the femoral triangles are not difficult. Now, if anybody asks you regarding to the contents of the femoral nerve, you can say that the femoral triangle possesses femoral nerve, the termination of the femoral nerve and its branches. So this yellow color indicates the position of what? The femoral nerve. This is the termination of the femoral nerve, and these all are the several branches. So femoral nerve lies in the lateral side of the femoral triangle. What lies? The termination and the branches of the femoral nerve, all yellow stuff. Then you can say that next to the femoral nerve, there is a structure in the femoral triangle, which is collectively called as the femoral sheath. We'll discuss shortly on the femoral sheath. So what lies in the femoral sheath? The first one is the femoral artery and its branch. So this one is the femoral artery. This is the femoral artery, and these all are its several branches. Then there is the femoral vein. So this one is the femoral vein. This one is the femoral vein. See that how femoral vein receives the great saphenous vein. And in addition, this area also possesses the deep inguinal lymph nodes. I told you the deep inguinal lymph nodes lies along the side of the femoral vein. So this is a picture showing you the different position of the contents of the femoral triangle. Again, see another picture of the femoral triangle. See this dotted line. This dotted line indicates how the triangle is formed. This is the base. Base is by the inguinal ligament. This is the medial. This is the lateral wall, and lateral wall is formed by the sartorius muscle. This is the medial wall, and the medial wall is formed by the adductor longus. So sartorius, lateral wall, adductor longus, medial wall, and this one is the base formed by the inguinal ligament. See the muscles found in the floor of the femoral triangle from lateral to medial. This one is the iliopsoas. Then there is the pectineus muscle, and this one is the adductor longus. Again, the same contents as I show you in the previous picture. For the femoral triangle, that one is the termination of femoral nerve and its branches. Then there is the femoral artery and its branches, the femoral vein and its tributaries, and the deep inguinal lymph nodes. Now, this is just a drawing showing you that how you draw the femoral triangle when a question comes to you in the examination. So, floor, it's mainly floor. You can say that this one is the iliacus. Floor, second muscle is the psoas major. Floor, third muscle is the pectineus. Floor, fourth muscle is the adductor longus. Base, inguinal ligaments. Lateral border, sartorius muscle. And then the medial border, the adductor. Adductor longus not only form the medial border, but it also contribute in the floor of the femoral triangle like this. Again, this is the femoral triangle, and showing you that what is the location of the muscles found in the femoral triangle from medial to lateral side. This time you can say that this one is the adductor longus, this one is the pectineus, this one is the psoas major, and this one is the leg. So whether you count the muscles from medial to lateral or lateral to medial, this is the arrangement of the muscles formed or found in the floor of the femoral triangle. Again, see the schematic drawing. When you draw the pictures on your gross anatomy journals, you can draw like this for the contents and the boundaries of the femoral triangle. So what lies from lateral to medial? This one is the femoral nerve. This one is the femoral artery. This structure is called as the femoral vein, and this structure indicates the position of the efferent lymphatics. Efferent lymphatics mean the lymph vessels from the deep inguinal lymph nodes passes through front of thigh just beneath the inguinal ligament to enter into the external iliac lymph nodes. These are just the description of the femoral triangle, triangular depressed area, just below the inguinal ligament, superior boundary. You can say that this one is the base formed by the inguinal ligament. Laterally it is formed by the medial border of the sartorius. When you go to the fine details, this is the sartorius, and this one is the medial border, and this one is the lateral border. But not go in detail, just remember that the sartorius forms the lateral wall or lateral boundary of the femoral triangle. Medially, it is formed by the adductor longus. In fine details, you can say that this is the medial border. This is the medial border. So where is the adductor longus? This is the adductor longus. This one is the medial border. This one is the medial border. So only medial border include into the medial wall of the femoral triangle, whereas the front of the muscle include into the floor of the femoral triangle. Apex, I told you that this is the point of the apex, where the medial and lateral border meets. And just from the apex, a new intermuscular space begins, and that space is called the adductor canal, or the subsartorial canal, or the hunter's canal. If the roof is formed by which structure? If the floor is muscular, then the roof is fascial, and the roof is formed by the fascia lata, deep fascia. And remember that the skin that lies over the femoral triangle is supplied by the femoral branch of the genitofemoral. The skin of the femoral triangle is innervated by cutaneous nerve, and this one is called as the femoral branch of the genitofemoral nerve. So he is talking about the posterior wall, and posterior wall is nothing. This is just the floor of the femoral triangle. Again, see here, these are the contents of the femoral triangle, and remember this structure. So when you count or enumerate the contents of the femoral triangle, the first one is the femoral nerve and its branches, femoral nerve, termination of femoral nerve and its branches. But second one is the femoral sheath. These all structures found in the femoral sheath. These all structures found in the compartments of the femoral sheath. So this one is the femoral sheath. I will show you how the femoral sheath is formed. But what lies within the femoral sheath? First one is the femoral artery and its branches, femoral vein and its tributaries. So this is the femoral vein and its tributaries. And then there is a femoral canal. This is the area for the femoral canal, which contains the efferent lymph vessels and the one deep inguinal lymph node. And finally, all structures are embedded in a fibrofatty tissue. All structures are embedded into the fibrofatty tissue. Now, kindly recall your memory. I told you regarding to the position of the deep inguinal lymph nodes, that they lie along the medial side of the femoral vein. So where is the medial side of the femoral vein? This one is the femoral vein. This one is the femoral vein. And these are the lymph nodes that lies along the medial side of the femoral vein, below the inguinal ligament. But these lymph nodes are the similar lymph nodes just above the inguinal ligament, are called as the external iliac lymph nodes. So this one is the external iliac artery, which is continue beneath the inguinal ligament as a femoral artery. This is the femoral vein, continue beneath the inguinal ligament and ascends as the external iliac vein. So these all are the lymph nodes along the medial side of the femoral vein. There are 3 or 4 in number, or sometimes 2 or 3 in number, and they are called as the deep inguinal lymph nodes. And the lymph vessels are the efferent lymph vessels of the deep inguinal lymph vessel. Deep inguinal lymph nodes ascends beneath the inguinal ligament to drain into the external iliac lymph nodes. Now this lymph node, which is located here in this position, is called as the lymph node of Kilauea. Lymph node of Kilauea. Can you see this picture? When you count the contents of the femoral triangle, just after the femoral nerve, there is a term written in your books, the femoral sheath. So femoral sheath contains all the remaining contents of the femoral triangle, like the femoral artery, like the femoral vein, and the deep vein. So this one is the area which showing you that the femoral triangle possesses an other structure now, and this one is called as the femoral sheath. Femoral sheath itself, see here, this funnel shaped prolongation is called as the femoral sheath. Right from here, this funnel shaped prolongation just beneath the inguinal ligament on the medial side of the femoral nerve is called as the femoral sheath. So femoral sheath is funnel shaped, and it is the downward protrusion or the downward continuation of the fascia of abdomen. Posteriorly is the fascia iliaca. So this one is the iliac fascia or the fascia iliaca. It is continued downward. And anteriorly is the fascia transversalis. So when these vessels, like the external iliac vessel and the external iliac artery, descends into the front of thigh, they carry the extensions of the fascia from the abdomen like a funnel-shaped structure, and these protrusions of both fasciae are collectively called as the femoral sheath. So this whole structure is made up of the connective tissue or the sheaths of the abdominal wall. Anterior wall of the abdomen possesses a fascia which is called as the fascia transversalis. And the posterior wall of the abdomen contains a fascia called as the iliac fascia. So here is the posterior wall, just contains the iliac fascia. See, this is the femoral nerve, this is the iliacus muscle, and this whole iliacus muscle is covered by this sheath. This sheath of the fibrous tissue is called as the iliac fascia. It extends downwards with the course of the external iliac artery when it becomes femoral artery, or the course of the external iliac vein when it continues as the femoral vein. And anterior wall of this sheath is formed by the other fascia which is called as the transversalis fascia. Now this is not a large structure. So see here that this structure which is called as the femoral sheath is just about 1 inch below the inguinal ligament. So below the inguinal ligament, protrusion of the fascial sheath, funnel shape, is about 1 inch or 2.5 centimeters or 2.5 centimeters. Now, how this fascial sheath disappears below the inguinal ligament? That the fascial sheath at its lower part fuses with the tunica adventitia of the vessels. So outer wall of the vessels, whether artery or vein, is called as the tunica adventitia. So at its lower part, at its terminal part, the femoral sheath is just blended with the tunica adventitia of the femoral artery and the femoral vein. So here, this is another picture of the femoral sheath, and it's now clear that this one is the posterior wall just behind the vessels, and this posterior wall is formed by the iliac fascia, and this is the anterior wall. This anterior wall is formed by the fascia transversalis. This whole femoral sheath is divided into 3 compartments by the 2 fibrous septa. So this is the one septa and this is another septa. It divides the entire femoral sheath into 3 compartments. The medial compartment is occupied by the femoral artery. So this one is the femoral artery. The intermediate compartment is occupied by means of the femoral vein. So this one is the intermediate compartment. And this one is the most medial compartment. This one is the lateral compartment. This one is the lateral compartment occupied by the femoral artery. Intermediate compartment occupied by the femoral vein, and the medial compartment occupied by the efferent lymph vessels. And this one is called as the femoral canal. This one is called as the femoral canal. So see that how this funnel-shaped structure is further divided into 3 compartments. One compartment, a second compartment, and third compartment by means of these 2 fibrous septa. By means of these 2 fibrous septa. Again, this is slightly a larger picture of the femoral sheath, and now we focus onto the femoral canal. Again, see here that femoral nerve not found in the femoral sheath. Femoral nerve is the content of the femoral triangle, but it not include among the structures or not occupied by the compartments of the femoral sheath. This is the medial compartment of the femoral sheath, just contain the femoral artery. Sorry, this is the lateral compartment of the femoral sheath occupied by the femoral artery. This is the intermediate compartment occupied by means of the femoral vein. And this is the medial compartment, which is occupied by the efferent lymph vessels. And this whole one is called the femoral canal. See here that the femoral vein receive here a large tributary, and this one is called the great saphenous vein. Femoral sheath lies just beneath or behind the deep fascia. So this gap is called the saphenous opening. This gap is called the saphenous opening. And this gap is filled in life by means of another fascia, which is called as the Kirbriform fascia, Now see the details of the femoral canal. Where is the femoral canal? The most medial compartment of the femoral sheath is called as the femoral canal. So the sole one is the femoral canal. What is its total length? It is about 1.3 centimeters long. So the length of the femoral canal, which found on the medial side of the femoral sheath, is about 1.3 centimeters long. Its upper opening is just called as the femoral ring. So this one is the femoral ring, or the upper opening of the femoral canal. Upper opening of the femoral canal. Sorry, femoral ring. So please again see the picture, again see the picture, again see the picture, again see the picture. बेटा ये अपने यहाँ से नाम हटा दो, पिक्चर को ऑक्यूपाई कर रहा है. What lies in the femoral canal? The femoral canal possesses or contains a little loose fatty tissue. So this whole femoral canal is filled with a fibrofatty tissue. Among the fibrofatty tissue, there is a one deep inguinal lymph node, and this deep inguinal lymph node is called the lymph node of Cloquet. And all efferent lymph vessels from the deep inguinal lymph nodes passes through this canal to drain into the external iliac lymph nodes, as I show you in the previous picture, like this. See here. You can say that this is the lymph node of Cloquet found in the lymph node of Cloquet found in the femoral canal. These all are the efferent lymph vessels. They pass through the femoral canal to drain into the external lymph nodes. Again, see here, this is the lateral compartment, this is the intermediate compartment, and this is the medial compartment, which is called the femoral canal. Femoral canal possesses just one inguinal lymph node called as the deep inguinal lymph node or lymph node of Cloquet. Second, it possesses the lymph vessels, the efferent lymph vessels. They all are embedded in a fibrofatty tissue. Again, this is the schematic drawing showing you that what lies in the different compartments of the femoral sheath. So this is a funnel-shaped structure. This is a funnel-shaped structure called as the femoral sheath. This is the entry wall. It is just formed by the fascia transversalis, and this one is the posterior wall. It is formed by the fascia iliaca. This is the area for the septa showing here. These are the septa that divide the femoral sheath into three compartments. The lateral compartment occupied by the femoral artery, the intermediate compartment occupied by the femoral vein, and the medial compartment is called as the femoral canal. The femoral canal possesses one lymph node, and this lymph node is called as the lymph node of Cloquet or lymph node of Rosenmuller. This is the position. Now this upper opening of the femoral canal is called the femoral ring. So this one is the femoral ring. Now there are several structures which are related to the different margins of the femoral ring. Anteriorly, we can say this is the inguinal ligament. Posteriorly, this is the area for the pecten pubis or superior ramus of the pubis. Medially, this is the lacunar ligament. This whole crescent shaped fold is called the lacunar ligament, and medial margin is completed by the femoral vein. So lateral margin is completed by the femoral vein. Medial margin is completed by the lacunar ligament. Anterior wall is formed by the inguinal ligament, and posterior wall is formed by the pecten pubis. So lacunar ligaments, femoral vein, inguinal ligament, and pecten pubis are just the boundaries of the femoral ring. What is a femoral ring? It is the upper open end of the femoral canal, whereas the lower end of the femoral canal is just closed. How it is closed? That the femoral sheath of this compartment, or you can say that the femoral canal at its lower part fuses with the tunica adventitia of the femoral vein. Fuses with the tunica adventitia of the femoral vein. Fuses with the tunica adventitia of the femoral vein. Now in life, this opening or this femoral ring is covered or it is sealed by a structure which is called as the femoral septum. So this opening of the femoral canal is just sealed by a extraperitoneal fibrofatty tissue of the abdomen called as the femoral septum. Femoral septum. And this femoral septum is relatively a weak area of this region of the abdomen. Now see this point which is called the femoral hernia. Femoral hernia most commonly occurring into the female compared to the male. Why it is more common into the male, why it is more common into the female compared to the male? Because of two reasons. Because of the two reasons. The first reason is this, that the female pelvis is comparatively wider than the male pelvis, and second, the size of the femoral canal is also wider than the size of the femoral canal in male. So wider femoral canal and the wider overall female pelvis is responsible for the femoral hernia. What is a femoral hernia? Very simple, very simple. That femoral hernia, in certain patients, the peritoneum or the part of the intestine passes through the femoral canal to reach into the front of thigh. This is the weakest area. So in the conditions of the coughing, sneezing, or in case of the constipation, what happens that continuously or slowly and gradually this area becomes weak and depressed. When the femoral septum depressed into the femoral canal, then there is the downward pushing of the contents of the abdomen, which may be a part of the peritoneum or which may be a part of the intestine that enters into the femoral canal, because this one is the empty space just containing the lymph vessels and lymph node. And this extension of the abdominal contents into the femoral canal is called as the femoral hernia. So this is the weaker point, the femoral septum depressed, and this one is the part of the intestine that it follow this weakest area after depression of the femoral femoral septum. It enters into the canal and finally it reaches into the lower part of the femoral canal. And it appears like this, which is called as the femoral hernia. So this one is just the femoral hernia. How the femoral hernia appears? When the femoral septum, a weakened part, depressed and give passage to the piece of intestine or its covering, which is called as the peritoneum or the extraperitoneal fat, and finally it reaches into the entire canal, and when reach its lower part, then it causes slight rupture of this femoral canal, and then it ascends to lie in front. Then it ascends to lie in front of the inguinal ligament. So see here that this is the femoral hernia. It is coming in this direction. When it reaches at this level, then it goes upward to lie in front of the inguinal ligament. And why this hernia is common into the female? I told you because of two reasons. And what are these two reasons? They are just the wider pelvis compared to the male, and the wider diameter of the femoral canal compared to the male. Oh, please, this is all about today. This is all about today. So if you have any question, if you have some question, please. Any question, please?
Sir?
Yes, sir. जी सर जी कंटिन्यू
anterior abdominal
बेटा strangulated hernia, irreducible hernia, it took time, so I will tell you about the details of this hernia in the coming class, that when this hernia becomes strangulated. But listen, when the blood supply of this herniated piece of the intestine is blocked, then there is the gangrene, or there is the constriction of the hernia, or the hernial opening, the contents becomes narrow. That one is called as the strangulated hernia. See here. When there is the twist of the organs, please listen. This is the area, this is the area. And here the strangulation occurs. Strangulation means, जैसे सिंधी में कहते हैं घुटोड़ना, गर्दन मरोड़ना. तो अगर यहाँ पे ऑब्स्ट्रक्शन हो जाए, इसमें ऑब्स्ट्रक्शन हो जाए हर्निया के पीस में, और उसकी ब्लड सप्लाई यहाँ पे ऑब्स्ट्रक्ट हो जाए, तो पूरे का पूरा पार्ट जो है वो डैमेज हो जाएगा. डैमेज होने का मकसद है कि यहाँ पे पैथोलॉजी हो जाएगी और गैंग्रीनस हो जाएगा. गैंग्रीनस का मकसद है कि इसकी ब्लड सप्लाई पहले आर्टीरियल और फिर वीनस रिटर्न ब्लॉक हो जाएगा. तो ये जो हर्निएटेड पोर्शन है ये कहलाएगा स्ट्रेंगुलेटेड हर्निया. अब इसको हमें इंसाइज करना पड़ेगा, काटना पड़ेगा, क्योंकि ये पीस अब खत्म हो चुका है. एनी क्वेश्चन प्लीज?
सर
हाँ यस
सर ऑब्ट्यूरेटर
जी बेटा.
सर जो ऑब्ट्यूरेटर नर्व है उसकी एंटीरियर और पोस्टीरियर डिवीजन में से कौन सी जो है आर्टिकुलर ब्रांच जो है हिप और नी को सप्लाई करती है?
बेटा पोस्टीरियर डिवीजन सप्लाई टू द पोस्टीरियर डिवीजन भी सप्लाई करती है, एंटीरियर डिवीजन भी सप्लाई करती है. बट आई टोल्ड यू that I gave you details when we discussed purely on the obturator nerve, because it took time that how anterior and how posterior deviant terminates after giving muscular branches, how they provide the articular branches. But articular branches supply to the hip as well as to the knee joint. But how, what is the mode of supply to these joints, we will discuss later, inshallah, in the coming week. आपके दूसरे क्लास का बड़ा टाइम हो गया.
Sir, adductor hiatus.
Adductor magnus.
Yes, sir. Sir, hiatus.
Beta adductor magnus.
Sir,
Yeah.
There was a space. What was it called?
Actually, the adductor magnus possesses 5 perforations. The largest perforation lies between the insertion of the hamstring and the adductor part. Through this opening, through this hiatus, the femoral vessel passes to become the popliteal vessels. There are
Sir,
other
what
openings.
This opening is called?
Opening is called adductor hiatus. Yeah, adductor opening. Adductor hiatus. This is the official name of this opening.
Sir, only femoral vessels pass through this.
Of course, the femoral artery passes through here to reach into the popliteal fossa to become the popliteal artery. And popliteal vein passes through here to reach into the front of thigh and become the femoral vein. There is another structure also passes here, but remember, this is mainly the femoral vessel. Yes?
Sir, सर आपने कहा है कि एडक्टर लॉन्गस जो है उसकी वो रोटेशन हेल्प करता है लेटरल रोटेशन में, लेकिन हमारी बुक में मीडियल रोटेशन में उसका फंक्शन दिया हुआ है एडक्टर लॉन्गस का.
कौन से बुक में बेटा?
सर स्नेल में.
स्नेल में क्या लिखा हुआ है?
सर यही कि एडक्टर लॉन्गस जो है वो मीडियल रोटेशन करवाता है, लेकिन आप जो पढ़ा रहे हैं वो लेटरल रोटेशन, तो वो फिर डिफरेंस कैसे, और क्या वो दोनों फंक्शन करता है?
एडक्टर लॉन्गस के लिए क्या लिखा हुआ है बेटा, दोबारा रिपीट करें.
सर मीडियल रोटेशन करवाता है, मीडियल रोटेशन.
बेटा go to the snail once again. Go to the snail once again. There is nothing written like the medial rotation. Everywhere it is written like the lateral rotation.
सर जो टेबल बना हुआ है उसमें
एंड
मीडियल लिखा
डिस्कसिंग
हुआ है।
विथ यू लाइक कौन सा एडिशन है आपके पास? बेटा कौन सा एडिशन है आपके पास?
सर 10th एडिशन।
10th एडिशन है।
ठीक है बेटा, मेरे पास भी एक एडिशन है जिसको मैंने लुक किया था, रात को ओवरव्यू किया था, वहाँ पे भी लिखा हुआ है लेटरल रोटेशन फॉर एडक्टर लॉन्गर, लेटरल रोटेशन फॉर द एडक्टर ब्रेविस एंड लेटरल रोटेशन फॉर द एडक्टर मैग्नस मसल, अगेन द लेटरल रोटेशन फॉर द ऑब्टूरेटर एक्सटर्नस। अगर इसकी कोई प्लस माइनस पॉइंट है तो उसको हम देख लेंगे, लेकिन जो मैं आपको पढ़ा रहा हूँ, जो मैंने पढ़ा, मैंने समझाया आपको, इट इज फ्रॉम अगेन स्नेल। ओके बेटा, आपका दूसरा क्लास स्टार्ट हो रहा है और उसके लिए जो है
लेक्चर अपलोड नहीं हुआ यूट्यूब पे।
बेटा मैं आज कर दूंगा अपलोड, मैं अभी कर रहा हूँ, ठीक है।
सर वन क्वेश्चन।
थैंक यू।